Good morning, everyone. I am Dr. Swami RM, Professor, Department of Pharmacology, Sri Siddhartha Medical College, Tumkur. Today, I am going to address about the topic called as adverse drug reactions. In this PH 1.7, I want to define about the ADRs, identify and describe the management of adverse drug reactions. Related to that, we are going to identify different types of adverse drug reactions, the management, how we manage these adverse drug reactions, important risk factors that predict the susceptibility of the adverse drug reactions, and explain some importance of monitoring and prevention of the adverse drug reactions. So, what is an adverse drug reaction? It is an unwanted or harmful reaction experienced following the administration of a drug or combination of drugs under the normal conditions of use and suspected to be related to the drugs. The reaction may be trivial, may be serious, or even it may be fatal. The World Health Organization has given a proper definition for adverse drug reactions. So, it is a response to a drug that is noxious and unintended that occurs at doses normally used in man for prophylaxis or diagnosis or therapy of the disease or for modification of the physiological function. So, adverse drug reaction requires the treatment, whether we have to stop the treatment or reduce the dose or caution in the future use of the drugs. So, the reaction may occur immediately or it may occur after a prolonged period of time, or even after stopping the medication the reaction may occur. So, classification of the adverse drug reactions. Based on the onset of adverse drug reaction, we can classify them into three categories. Acute, when the reaction happens within 60 minutes of administration of a drug, we call it as acute. Subacute is one where it happens within 24 hours. Latent after around 2 or more days. So, what are the different types of adverse drug reactions? We can remember like A, B, C, D, E, F. So, type A reaction is also called as augmented reaction. Example for this is hypoglycemia that occurs with a dose of insulin. So, here the person when given insulin may have an experience of hypoglycemia immediately. So, it is generally a dose related phenomenon where there is increase in the dose can cause a reaction. The second type of reaction is B, that is bizarre type of reaction, where it doesn't involve it doesn't take into consideration of the dose. It happens even with a very minute amount of the dose. So, here it depends on the patient peculiarities more than the drug. So, here the types we have is like allergic reactions, what we commonly encounter in practice, or it may be some idiosyncratic reactions. The third variety we call it as type C reaction, or it may be due to continuous use of a drug. That is, a patient with arthritis who is on non-steroidal anti-inflammatory drugs may land up with severe gastritis. So, this is a continued use of a drug. So, next we have this type D or delayed hypersensitivity reaction, that is fetal hydantoin syndrome. If a mother is on phenytoin sodium for epilepsy, so the baby may be born with the teratogenic effect or anomaly, call it as fetal hydantoin syndrome. Or the reaction may happen after the end of the use, particularly this corticosteroids. If a patient is on corticosteroid for a long term, suddenly if a patient stops, there may be acute adrenal insufficiency. Last is the failure of therapy, where it may be related to like OCP, oral contraceptive failure on a patient with antitubercular therapy. Particularly the drugs like rifampicin, which is an enzyme inducer, can cause oral contraceptive failure. So these are some of the important types of adverse drug reaction, type A to type F. So based on the severity of the adverse drug reaction, we can categorize them into minor. So this minor adverse drug reaction many a times doesn't require any treatment, it subsides on its own, or they need a minimal treatment with antihistaminics and related drugs. No hospitalization is required for this patient. The moderate adverse drug reactions are those which requires the change in the drug or a specific antidote requirement is necessary, and also the patient may require hospitalization. The severe adverse drug reaction is one where it is potentially life threatening, where it can cause permanent damage to the most of the end organs, and also a prolonged hospital stay may be required for these patients. So what are the consequences of this adverse drug reactions? What are the serious consequences? So it may lead to death, it may be life threatening or require hospitalization, require prolonged hospital stay, can cause permanent disability, or it can cause many congenital anomalies, require intervention to prevent permanent injury. So what are the different types of adverse drug reactions? There are many types, I will go one by one. So the first one being the side effects, which is very common, which is a known adverse reaction, which is we can predict and you can minimize the adverse drug reaction if you know the pharmacology of the drug. So the first one is side effects, which is unavoidable pharmacological action of a drug. It is predictable, reduce the dose, ameliorate the intensity of the reactions. So example for this is you can give antihistaminics, which can cause sedation as important side effects. Next is the secondary effect. So what is the secondary adverse effects? So it is indirect consequence of treatment of a disease. So particularly if you use a broad spectrum antibiotic like tetracycline, it not only it destroys the normal flora also, normal bacterial flora. So that can lead to super infections. So this is the secondary consequence of primary use of the drug. So if you use corticosteroids for a long term, it causes immune suppression leading to oral candidiasis, which is a fungal infection. So the third one is the toxic effect. This generally occurs at higher doses. So overdose or prolonged use of the medication can lead to toxic effect. Particularly this paracetamol in very high doses, it can cause hepatic necrosis. It releases a toxic metabolite called as benzopyrenamine. So that can cause toxicity to the hepatocytes and can lead to hepatic necrosis. Or morphine at a very toxic doses can lead to respiratory failure. The fourth one is intolerance. So it is opposite to the tolerance. So increased sensitivity of a person to the lower doses of the drugs. So here few doses of carbamazepine, which is an anti-epileptic drugs, can cause ataxia, or a single dose of trifluopromazine can cause muscle dystonias. Idiosyncratic reactions. What is this idiosyncratic reactions? This is genetically determined atypical or bizarre reaction that can occur, where the administration of a succinylcholine, which is a skeletal muscle relaxant, can cause prolonged paralysis. So this is mainly due to an enzyme, atypical pseudocholinesterase. Streptomycin, a single dose, which is an aminoglycoside acid antibiotic mainly used for gram-negative bacterial infection, can cause deafness even with a single dose. So drug allergy or hypersensitivity. So generally we have it is generally immunologically mediated. So it is independent of the dose and can occur even with the smallest doses. So prior sensitization is required where there is exposure that causes this antigen antibody reactions, all those things. So generally 1 to 2 weeks is required after the first dose of this drug. So drug mainly acts here as an antigen or an aptin. So chemically related drugs can show the adverse drug reactions, or the same drug can produce different allergic reactions in different individuals. So what are the different types of this ADRs? There are type 1 to type 4. Type 1 is immediate hypersensitivity reactions where the patient may present with urticaria. There may be angioedema, which is a severe type of reaction. The patient may have bronchoconstriction or asthmatic like attack, or there may be anaphylactic shock where there is laryngeal edema. The patient may have laryngeal edema, which is a very severe type of reaction. Type 2 reaction mainly is on the hematological system where there is thrombocytopenia, agranulocytosis, aplastic anemia, or it may be systemic lupus erythematosus. Type 3 reactions are like arthralgia or very severe reactions like Stevens-Johnson syndrome. Most of the drugs like sulfonamides are known to cause this. Type 4 reactions, we have contact dermatitis, fever, and photosensitization. Photosensitization, we have this phototoxic and photoallergic reactions. So first three, for type 1 to type 3 are humoral adverse drug reactions, whereas the type 4 is the cell mediated hypersensitivity reaction. In this picture you can see a number of commonly occurring adverse drug reactions to various drugs. Of this, very important to remember some life threatening dermatological manifestation related to the drugs like sulfonamides and related groups. So what is this photosensitivity? Photo means light. A person becomes sensitive to light on administration of a particular drug. So it is two types, that is phototoxic and photoallergic. Phototoxic reactions, so the drug accumulates in the skin, absorbs the light, photochemical reaction occurs, photobiological reaction happens, and tissue damage, so like leading to erythema, edema, blister formation. These phototoxic reactions are very common with broad spectrum antibiotics like tetracyclines. Photoallergic reactions, they are mainly cell mediated immune responses to a drug where contact dermatitis or to exposure to the light, like drugs like sulfonamides and griseofulvin, which is an antifungal drug, causes photoallergic reactions. So these are some of the reactions you can see in the picture. Next concept is the drug dependence. What is drug dependence? It's of two types: psychological dependence and physical dependence. Psychological dependence is very common where the person psychologically depends on a drug, okay, where without the drug he cannot survive, okay. So that is called as the psychological dependence, where for the drug of addictions like morphine, alcohol, these drugs can cause this psychological addiction, and over a period of time the person starts using this drug continuously, where there are biochemical and physiological modification in the response to the drugs that can lead to this physical dependence, which necessitate the presence of the drug for the person to be normal. Next concept is the teratogenicity. What is this teratogenic effects? So generally when drugs administered during pregnancy, so they can cause some effects or toxicities or anomalies in the child. Very important example of this is a thalidomide disaster, so which led to the lot of agencies to come. So this thalidomide was the drug which was used for morning sickness during 1956. So more than around 20,000 babies who were born without or a short limbs, both upper and lower limbs. We call that as a seal-like limb, okay, or phocomolia, okay. So one more important drug like phenytoin sodium, what we use when used during pregnancy, can lead to cleft palate. So this is the picture where you can see this cleft palate and baby with phocomolia. So next type of adverse drug reactions are carcinogenicity and mutagenicity. So here some of the drugs what we use for treatment of cancer, they themselves can cause alteration in the genes that we call it as the mutagenic effect or carcinogenic effects. So drugs, so most of these anti-cancer drugs like alkylating agents or this thing, they can anti-metabolites, all those drugs can cause this carcinogenicity or mutagenicity, including this estrogen, which can cause these problems. So drug induced disease or what we call it as iatrogenic disease. So what is this iatrogenicity? So here, so the doctors who prescribe should be aware of the common adverse effects of the drugs. Otherwise, if the patient comes with a gastric ulcer, already is suffering from gastritis, if you prescribe them the salicylates, which also can cause gastritis, okay, gastric ulcer. So salicylates can cause peptic ulcer. You can avoid that if you take a proper history about this drug. So phenothiazines can cause Parkinsonism. So INH, isoniazid, can cause hepatitis or liver related issues and all. So these are all some of the drug induced disease, or we call it as iatrogenic diseases. So what are the other type of adverse drug reactions? We have drug withdrawal reaction. Example, a drug called as propranolol, so which is used as a non-selective beta blocker. So most of these beta blockers, suddenly when you withdraw, there is sudden increase in the blood pressure. And one more drug, if the person is on long-term use of this corticosteroids, the sudden withdrawal of these corticosteroids can cause acute adrenal insufficiency. Always we should plan to taper the dose of these drugs and decrease the dose. So what is the management of these adverse drug reactions? So what is the main thing you have to do whenever you can come across this adverse drug reaction? Based on the severity, you should plan the treatment plan. Okay. So main thing is like discontinue the offending agent first. It can be easily stopped. The event is life threatening or intolerable, you have to immediately stop the drug. So there is if there is a reasonable alternative, you stop the drug and use the safe other drug of the different groups. Continue the medication will further exacerbate the patient condition. So you should be very careful, you should take action immediately. So if you want to continue the medication, so if it is absolutely needed, you need to go with the safer drugs. Coming to the management of ADS, so discontinue the non-essential medicines. Always see to that do not use unnecessary multiple drugs for the condition. Use minimal needed drugs for that condition. So administer the appropriate treatment. Select a appropriate personalized drug or the drug of choice for that particular condition based on the evidence. So provide a supportive or a palliative care like hydration or giving glucocorticoids or cold or warm compression. Whenever required, you can use this analgesics or antipyretic if required. So in some incidents, we can go to identify whether the drug has caused adverse drug reactions or not. We have a process called as re-challenging and de-challenging. De-challenging is one where we stop the medication and see whether the reaction subside. Re-challenging many times we do not do because of some ethical issues, where you can reconsider to give the medication, see whether the reaction happens again. What are the important risk factors for these adverse drug reactions? So the extremes of age is very important, the age where the children are more susceptible to most of the drugs because the metabolic process is not well developed till the age of 6 months or 1 year. So most of the drugs have to be used very carefully for this in the pediatric age group. Elderly, because they would have got compromised with the organs functions. So there also the use of the drug, or you need to monitor or tailor the dose of the drugs in elderly population. Polypharmacy is one of the important problem. Most of the drug interaction for each ill as a pill, there is a saying that each ill as a pill. So polypharmacy is one more much problematic issues. So multiple comorbid conditions, the patient may be suffering from heart disease, may be suffering from diabetes, may be suffering from renal issues. Okay, all these things will be there. He will be on those medications also. the more chances of adverse drug reactions. And the part of the doctor, like inappropriate medical prescription, also will count for the adverse drug reactions. So altered physiology in that particular patient, okay, if not taken the proper history about the allergic reactions in that patient, that can also contribute to the lot of problems. And the extent and duration of use of the drug. So there is a particular duration for each drug. If I want to use like an antibiotic, it is 5 to 7 days, like that. There is a fixed duration for each drug. Should not overuse the drug, or you should not underuse the drug. And also it depends from person to person. A response to a drug, there is a 20-fold variation in response to a drug with each individual. So it is also related to the genetic predisposition. So why we have to report adverse drug reactions? So it is one of the important thing. So do you want to report the adverse drug reactions or not? Yes, we want to definitely report the adverse drug reactions. So what is the difference between this clinical trial and practice? In most of the clinical trial, the drug before it gets into the market in the phase 4 clinical trial. So here it is tested in very few people, like around maximum up to 1,000 people may be exposed to this particular drug. So in phase 4 trial, when the drug, the crores of people are using this drug, lot of adverse drug reactions may manifest in the later part. So we have a field of pharmacology called as pharmacovigilance, which is mainly concerned with the monitoring of these adverse drug reactions. This also, if you properly take care of this adverse drug reaction, you can reduce the treatment cost for the patient, hospitalization, hospital stay, hospital bills. So everything you can reduce. You can reduce the health burden and economic burden for the country and also for the patient. So this is the severe reactions where you can see severe adverse drug reactions. So what you need to do whenever you have an adverse drug reaction? So very simple, most of the adverse drug reactions, if it is mild, you go with some antihistaminics that will take care. If it is bit severe like anaphylaxis and angioedema, so we need to go with a drug called as adrenaline, which we give like 0.2 to 0.3 ml by intramuscular route. So which takes care of this reaction, because most of this is related to this system. In this adrenaline is a physiological antagonist of this histamine, where it takes care. So and also we can use drugs like second generation, first generation antihistaminics, which are very good drugs for this, like chlorpheniramine malate, and corticosteroids like hydrocortisone can be used. So these are the drugs which we commonly use for most of these reactions. So the other part is, so when you identify these adverse drug reactions, you need to report to the pharmacovigilance unit of a particular hospital. Okay, later on they will take the issue to the higher centers. So what is this adverse drug monitoring center or pharmacovigilance? So it is mainly this pharmacovigilance program is associated with detection, assessment, understanding and prevention of adverse drug reaction. So it is an observational post-approval scientific and data gathering activities related to adverse events or adverse drug reactions. So why we need to do this pharmacovigilance? So a lot of self-medication, people have started taking medication from the pharmacy shop without the prescription, and there are a lot of drug promotional activities where there were a lot of drugs are coming into the market. The largest, India is one of the largest producers of the drugs. Use of outside and drugs which are not undergone clinical trial properly. So rapid approval, that is Me Too drugs are releasing in a faster way. So online purchase, this is one more problem where the you get the drugs to your house only from the agents. So pre-marketing studies, so it cannot detect because we study in only less population, number of patients involved are very minimal, done in a short periods. Okay, stringent condition, no comorbid conditions will be there. So but in real situation it is not there. So the problem with of ADR is increase in hospital admissions and inpatient developing more adverse drug reaction, escalation of the hospital cost, there may be chances of deaths majority of the reactions are preventable. Who can report all this adverse drug reaction? So this adverse drug reactions, all the doctors, the nurses, paramedical staff, the lab persons, or the medical students, everyone can report to the concerned this thing. Each medical college has a pharmacovigilance unit where you can report whatever you find this adverse drug reaction. You can report to the concerned people. So here we have a adverse drug reaction form where it contains complete details how we have to fill all those things. Your seniors or the doctors will guide regarding this, or a pharmacologist who will be in charge of this pharmacology unit can guide you properly related to this. Okay, so you can relate. You can later on they will send the reports to the higher center. There is regional center, zonal center. We have a national center where it is in Ghaziabad, and an international center in Uppsala Monitoring Center in Sweden. So these are the places where your report goes. So once you report, you also have to tell the related to this ADRs in different CMEs meeting. You have to publish this in and also present in conferences and in WhatsApp group, and all the people who doctors, you can send this message that the drug is known to cause this. So you have to create a signal. Signal is one where from this ADS you are generating a signal, it has to reach to the higher authorities. So where they can properly take a regulatory action, whether they can ban the drug or modification, they can modify with, they can bring back the drug with few modification, all those things are there. So some of the drugs which are banned like nimesulide, gatifloxin, you are already aware of this. These drugs can be banned because of your reporting. Okay, reporting is very much essential. So it is all your responsibility to go through this. Any reaction happens, please do report to the pharmacovigilance unit. Okay, so adverse drug reaction monitoring is a road to patient safety. Thank you. Thank you very much.